Let's go to the telephone. Senator, are you on the line?
I am, Tim. How are you this morning?
I'm great, thank you. Senator Roy Blunt joins us from Washington, and well, I guess let's start kicking the can here. Obamacare had a really bad day yesterday.
Well, they did have, but I will tell you, Tim, I think that the administration at some point will look back at the time when they had the website to blame as the good old days. I mean, this is just a plan that will not work. It's based on faulty principles. What I've been saying about it for 4 years now is turning out to be exactly right for the reasons that I said it would be right, and I wasn't the only critic. This is not self-aggrandizing here. It's just that this is the idea that you would have a plan where you tell people, first of all, that if they can get insurance once they get sick, they don't necessarily have to have it before they're sick, and then you expect young, healthy people to pay the burden of that by buying insurance at higher rates than they've ever seen before, were just two fundamental principles that were never going to work. And now we're seeing what happens when those things collide together. The biggest enemy of Obamacare will be Obamacare. And the more people find out about it, the harder it is for the president to say things that turn out not to be accurate. Like right now he's saying, well, once the website's up, you're going to find better coverage for less money, and that's just not true. Almost nobody is going to find coverage for less money than the coverage that they thought met their needs that they had before, that they're now losing to the tune of millions of people being notified that your insurance is no longer available and you have to find it somewhere else.
So do you think it'll die on the vine, Senator, or are we going to have to endure it?
Well, the best thing to do would be to start over again. You know, we had the best healthcare system in the world, but it wasn't perfect. It wasn't working for everybody the way it should, and what we should have done was figure out how to make that system work better than totally disrupt it by thinking the government could get involved in every single American's insurance, health insurance. So the best thing to do, I think this is unfixable, to tell you the truth, Tim. I'll work with everybody I can to be sure that we need to meet the needs of people who have true health care concerns. Now, I'm going to go to the floor in a few minutes and talk about a number of examples, or at least one this morning. I talked about others yesterday, of people that are contacting our office, like the family from Ornogo near Joplin, son born with a medical condition which created a buildup of fluid in his skull. It's a constant, ongoing challenge for this young man. His first surgery was when he was 18 months old. He was on the state high-risk pool, and they were satisfied with that. It seemed to be working for them, but, of course, Obamacare eliminates the high-risk pool in Missouri for the 4,300 people that were there, and that's how they dealt with their pre-existing condition. And now all the choices this family has, he won't be able to have the doctor, the neurosurgeon he's had during most of his life. He won't be able to go to the hospital he's gone to during most of his life because, again, the government decided they could figure this out for every American better than they could just solve individual problems with things like a better working high-risk pool or a bigger marketplace by buying across state lines, or medical liability reform, or fair tax treatment for everybody that gets health care, whether you buy it on your own or you get it at work. And all those things are now coming home to roost if the president would have listened to the handful of things, or maybe even the double handful that could have been done, rather than deciding that the government could do this better by getting so involved, we'd be a lot better off today.
Well, this is more, in my view, now about politics than health. How does the president save face? If we start all over, then that looks like an obvious defeat for Democrats, and they're not willing to do that.
They've got a big problem here. Everybody who supported this law has a big problem, and I think they all are beginning to know it. Remember, this is a bill that passed without one single Republican vote. I was organizing the alternatives in the House, which is why I get particularly aggravated when people say, well, there was no other alternative. The other side didn't have ideas. We clearly had ideas. We had a handful we had a double handful of bills, as I recall, none of which were longer than 75 pages long. They were individual. They were understandable. They were not 2,000 pages of rewriting the health care law so you could have 20,000 pages of new rules. The president could have clearly found ways to make this a bipartisan effort, but the president and the Speaker of the House, Nancy Pelosi, and the leader of the Senate, Harry Reid, decided that they were going to do this as a one-party. Democrats in Washington are going to solve your problems, and here's how they're going to do it. And now Democrats in Washington, frankly, have a huge problem because there's nobody else to blame but them for a system that clearly has lots of flaws. And, again, once people begin to see the flaws, it's hard for them to continue to say things that just simply turn out not to be true. The biggest one perhaps being, if you like your policy, you can keep it. If you like your doctor, you can keep your doctor. But there are also things right now being said that aren't true, which is once the website's up and working, you're going to find better coverage for less money. Almost no one is going to find better coverage for less money. And I've got dozens of stories of people who their coverage is going up 50% and 100%, and it's less coverage than they had before.
And isn't it interesting that California, out of the 106,000 that have signed up, a third of them, 35,000, are in California, which begs the question, why not this just be a states' rights issue? If California wants to do it, fine. If Massachusetts wants to do it, fine. If Missouri doesn't want to do it, fine.
Well, actually, I didn't think that Governor Romney dealt with this in the best way in his campaign, but that was his position, that this was something the states could do if they wanted to. He didn't run away from the Massachusetts plan, but didn't suggest it was the right plan for everybody. So that's clearly one way to look at it. By the way, I read also this morning somewhere that how many people did you say in California have signed up?
35,000, about a third of the total.
Which is less than 1% of the people in California who don't have insurance.
Yeah.
So that sounds like a big number until you realize really it's less than 1% of the people of California.
No, it's all tiny.
Who don't have insurance.
We're talking 100,000 for the entire nation. It's incredibly low number.
Even in California, they have 100 times that many people who don't have insurance. So it's still a drop in any bucket you want to look at. And the numbers way, way below where they'd have to be. You could find these extrapolations out there where it would take 500 years or something at this rate for everybody to sign up. But people are not going to sign up for coverage that doesn't make sense for them. Young, healthy people are not going to pay twice as much for insurance as they have decided in the past was too much. That was the biggest uninsured population. And the president's health care plan relies on young, healthy people paying a higher rate than ever before. Right now, there are like 5 different levels of insurance based on age, to where someone in their 60s, before they get Medicare, may be paying 5 times as much as someone in their 20s. But now, with the new law, they can't pay more than 3 times as much. And so that means that person in their 20s is going to look at a policy that's a whole lot more expensive. And remember, these were the people who didn't buy insurance at the old rate. And then remember, you've told them that you can get insurance once you get sick if you happen to have something happen to you that no healthy young person thinks is going to happen. You can get coverage after you have a pre-existing condition. These are just premises that will not work, and the quicker the president admits that, the better off the country would be.
But the first stepping stone, I think, is the worst problem of all, and that's the government credibility. Do I want to sign up on this website having been warned that there may be a security issue with my information?
Oh, I think you're exactly right. Who would want to put all this information out there? A government that can't even keep its national security secrets secret. What makes you think they're going to keep your health care information or your financial information secret? And the question that members of Congress, including me, have been asking is, did you run this through any kind of test to be sure that it really meets security standards? And the answer, amazingly, was not really.
And a remaining moment with you.
The chairman of the House Intelligence Committee, Mike Rogers from Michigan, who knows a lot about these security issues, obviously, on computer, was just outraged at the answers that he got because he knew what he was talking about. And clearly the people from the Health and Human Services didn't appear to have any idea why they should even have this level of concern.
Just a moment left with you. Where's this going in the short term this week?
We'll see what the president has to say. I think they're in a really bad place and deserve to be. They have a plan that was forced on people in a partisan way, and they act like they're going to come up with a solution today for people who relied on his promise that if you liked your insurance, you can keep it. I think it's a lot easier to say you can solve that problem than it will be for them to figure out how to solve that problem.
Why don't they just delay it, Senator?
After these companies have all decided not to issue the policies anymore that the government told them they couldn't issue.
Why not just delay it till after the midterm?
Well, it'd be a gift to the president and a gift to the American people both. Not doing this is a gift to the American people. People not finding out what happens when you do it is a gift to the president, and that's the calculation right there. Do you want people to continue not to know what's going to happen here? No matter when you implement this, it's not going to work. So the midterms might give us the numbers we need to force the president to dramatically change it. And if there's a vote to delay, I'll certainly do that. But you're literally kicking the can down the road, and you probably wind up with more people uninsured rather than more people insured. I'm confident that 2 years from now there'll be more people without health insurance than had insurance 2 years ago, which by any standard would mean that this plan would be a total failure.
Appreciate the visit.
Good to talk to you, Tim.
Thank you.
Hope to be in the studio soon, and I'll see you there.
Anytime. Thank you, sir.